Begin by checking what precautions are appropriate to your patient. In this video, we will address droplet precautions. Remember, of course, it's important that you don't adjust your PPE or touch your face while in the containment area. For this very reason, stop before entering the room, take your time and check that everything is in place and you're feeling comfortable to proceed. When putting on PPE in practice, again, take your time fitting the equipment and make sure it's comfortable. Then enter the containment area. Remember, the first rule of safety is that you do not put yourself at risk. In donning, the first step will always be hand hygiene. This can be done using alcohol-based gel or washing hands with soap, using good hand hygiene technique. Ensure that your watches are off and that you're bare below the elbows. Apply liquid hand sanitizer to your hands and rub the palms of your hands together. Then place one hand over the top of the other and rub the back of your hand, interlacing with the web spaces. Repeat that again on the other side. And next, rub your fingertips into the palm of your hand and repeat again on the other side. Rub the gel around each thumb and around the area of your thumb, and finally go around each wrist, ensuring you rub gel the whole way around. Keep going through this sequence until your hands feel dry. Now your hands are clean, you can open up your gown, place your hands through the sleeves and have the opening of the gown facing backwards. Secure the gown using Velcro around your neck and ensure that the gown is overlapped at the back, ensuring that your scrubs are covered from behind, and tie the gown around at the rear. Don't tie your gown at the front. Next step is to apply a surgical mask. Surgical masks haven't been designed to provide a closed seal around the face or offer high-level particle filtration. Therefore, these masks are to be used in situations when there is a risk of droplet transmission. Check that you've got the mask the right way up, with the flexible bridge facing up and the coloured surface facing out. Open the mask and place the mask over your face and secure it either using ties or elastic around the ears. Now, adjust the flexible bridge over the nose and cheeks. Now that you've fitted your mask, it's time to apply protective eyewear. Protective eyewear shields your eyes from direct contact with respiratory droplets and any accidental contact from contaminated hands. There's a variety of protective eyewear which can be referred to as goggles, protective glasses, visors, or face shields. If you wear prescription eyewear, put these on prior to the protective eyewear. Whenever putting on any type of eyewear, it's good practice to use the arms of the frame. Make sure your eyewear is sitting securely and isn't affecting the fit of the surgical mask. Finally, the next step is to apply gloves. Fit the glove on your hand. Pull the end of the glove over the cuff of your gown. This will make a tight seal, reducing the potential for contamination of the wrists and forearms. Of course, repeat this for the second glove. We'll now address doffing, remembering that doffing holds a high risk of infection if we don't take our time, so please be methodical in this process. Start by removing the first glove, holding the cuff and rolling it down into the palm of your other hand. Now you can remove the second glove by placing your finger under the glove carefully and essentially turning it inside out, encapsulating the glove that's already in your palm. You can dispose now of the two gloves together. You must now perform hand hygiene. This time, the use of an alcohol-based hand hygiene product is more convenient and accessible. However, hand washing with pH-neutral soap and water is also acceptable practice. When using alcohol-based hand rubs, remember to allow the product to dry completely. Next step is to remove your gown. Now, your gown has a very large surface area and is another area of potential contamination. Therefore, take care and remove it in a controlled manner. First, undo the ties. If you're having difficulty doing this, seek some assistance, or if the gown is disposable, carefully tear the ties. Once all ties are undone, take hold of the top inside surface of the gown, lean forward and start to remove the gown by pulling it away from your body. As you remove it, fold it over so the contaminated surfaces are on the inside. Continue doing this until the gown is a small folded parcel, and place the disposable gown immediately in the waste container. After removing your gown, it is again essential you perform hand hygiene. Using both hands, remove your protective eyewear by holding the arms of the frame only. The last thing to remove in this process is your surgical mask, and you'll do that by untying it at the back or removing the loops from around your ears. Ensure you're leaning forward at this time with your chin up, and this ensures the mask doesn't touch you as you remove it. You can drop the mask straight into the bin. And again, the final step is to perform hand hygiene one last time, ensuring you continue the sequence until all gel is rubbed and hands are dry. This completes the doffing procedure.